Welcome back to TV5 News at 9, everyone. Time now for Medical Moments with Covenant Healthcare. Joining us this morning, please help me welcome Angie Bradley, a nurse navigator. Angie, it's good to have you. How are you?
Thank you. I'm well, thank you, and thanks for having me.
Of course. We're talking about a very important topic, colorectal cancer awareness. So Angie, start us off with the significance of Colorectal Cancer Awareness Month.
Yeah, so 25 years ago, they started designating March as Colorectal Cancer Awareness Month with the hopes of educating the community about the importance of early detection and awareness.
Okay, just for, someone who's maybe not so familiar with colorectal cancer, what is it?
So colorectal cancers are cancers that form on the inside lining of the colon and rectum. Generally, they come from polyps that grow slowly, but sometimes can form cancerous tumors.
Okay, and what would you say are risk factors for this type of cancer?
Yeah, so there are a few risk factors for this cancer, and some that you can prevent, and some that you don't have any control over. Okay. So your age, as you age, sometimes your risk will go up, and people that have irritable or inflammatory bowel disease like Crohn's
Would IBS
those types,
count?
yes. Well, not necessarily, but it's the more inflammatory types like Crohn's and ulcerative colitis. That's what I was searching for.
Yeah, you're good.
Yeah, and so there are other risk factors too that we can actually do something about. Okay. So obesity is a big problem and can increase your risk. So eating a healthy diet that's healthy, grains, vegetables, fruits, limiting red meat intake, that kind of thing. Okay. Exercise, keeping your weight down by those things, and also limiting alcohol and quitting smoking are big factors that you can control.
Right. We love controllable factors.
Yes.
Okay. Kind of screenings. What are available out there, and when should someone start?
Yeah, so they just lowered the age that they recommend starting to 45 from 50 because we have noticed an uptick of younger people that are being diagnosed with colorectal cancers. The types of screening, there's two main types. One are the stool-based tests. So they're tests that you take a sample of your stool, send it into the lab, and they check for things like blood or DNA changes. And then direct visualization is the other type. So that's like a colonoscopy. And that's the gold standard because the physician can actually put the scope in there and visualize, look for polyps, and actually remove them, which in essence is preventing colon cancer. If we can get those polyps out before they turn into tumors, then we're doing a good job.
Yeah.
Yeah.
That's why early detection's key.
Exactly.
All right, that makes sense now. Can you go over some of the treatments, though, for people who, may unfortunately be diagnosed with colorectal cancer?
Yeah, so colon and rectal cancers are actually treated a little bit differently. Colon cancers are most generally treated first with surgery, and then they examine the specimen by a pathologist, and if there's any high-risk features like lymph nodes that have cancer in them or positive margins or anything, then some patients go on to have chemotherapy. Now, rectal cancer is a little bit different, and it's a little bit more tricky to treat in depth, and it's usually treated with a combination of different modalities. So we have usually chemotherapy and radiation therapy followed by surgery. So it's important that you have a team of people that are experienced and knowledgeable in treating those types of things. And at Covenant, we have a nationally accredited rectal cancer program. And so that just means that we've been found to have go by the highest standards. All of our oncologists and surgeons are up to speed on all the latest rectal cancer treatments.
I know there's much pride from Covenant in being accredited, so that's very good to hear.
Absolutely.
If someone has concerns about colorectal cancer, how would you suggest they seek care?
First of all, I think patients need to talk to their primary care physicians because, again, there are risk factors involved. You can talk to your physician about family history. That's a big thing. So know your family history, and they can screen you for all of the different types of things that may impact when you should start and how often you should be screened.
Is there anything that you want to add about colorectal cancer you didn't get the chance to say yet?
Well, I think that we talked a lot about screening and prevention, but I'd like to just warn people, even young people, that if you have any signs or symptoms of colon cancer, please get to your family doctor right away and notify them for additional and, testing and so forth. But signs that to look for are blood in the stool, abdominal pain and cramping, unintentional weight loss, and those types of things. You really want to get to your doctor immediately.
Very good. Yeah, just any change in general, I'm sure.
Exactly. Changes in bowel habits are a sign as well.
Okay. Angie, I appreciate your time this morning. Thanks for coming in.
Thank you so much for having me.
You're very welcome. And if you would like any additional information on today's topic, make sure you head over to our hot links page on our website at WNEM.com.